Iredell Health System experienced a lot of growth in many key areas during fiscal year 2015. From the growth of Iredell Health System and partnerships with other physicians in the community, to the addition of several programs, each of these initiatives is strategically focused on meeting the healthcare needs of an expanding community and positioning Iredell Health Center as the leading healthcare provider. Our commitment to quality care starts with the physicians we employ and partner with. We're fortunate to bring on board several experienced physicians as part of the Iredell Physician Network, expanding our footprint into Alexander County and broadening our service offerings to the community.
There's a couple things that really attracted me about Iredell. Number one, they have a consistent commitment to excellence. I've been consistently very pleased with every aspect of how the hospital has treated my patients and helped me care for my patients. The second thing is that I think that Iredell has a vision that's broader than simply taking care of patients. They have a vision of where they want to go. And I think the big difference here is that the doctors still have great input into patient care, which is as it should be. And so the hospital works with us, we work together to try to provide the best quality patient care.
I chose to work at Iredell because over my 10 years here in the community, I've been able to watch them grow as an organization. They have stayed committed and true to the community and to the physicians and staff that they have working for them, as well as the individual patients. I really was impressed with the way that they focused on health and wellness for their staff, not just for their patients.
Iredell Health System has supported Family Care Center by giving to the practice increased management tools. They've relieved us of some of the administrative burden, so this way we can do what we do best, and that's care for patients.
As a not-for-profit health system, all profits are reinvested back into the community. This allows Iredell to bring life-saving, innovative technology to the community.
This past year, we've made investments in technology, one of which includes the replacement of an older CAT scanner with a newer one, which is capable of doing low-dose CT scanning utilized for screening for lung cancer. The screening is designed to detect small tumors of the lung that otherwise would not be seen.
Barrett's esophagus is a change that occurs in the lining of the esophagus from chronic acid reflux disease.
Most of the patients with Barrett's esophagus, they don't know that they have this condition. A lot of people, they ignore acid reflux. That's the reason why the Barrett's esophagus has been so underdiagnosed. But having said that, every year in the United States, 2 to 3 million people get diagnosed with Barrett's esophagus. Our hospital has been quite responsive to some of the newer technology that has come out. At Iredell now we have this new technology called radiofrequency ablation, and it is a huge advantage for our patients now because we don't have to send them anywhere, and they would prefer to get their procedures done over here. And they all have some peace of mind that they're getting rid of precancerous condition from their body.
There have been a number of other treatments over the years, but one advantage of this treatment is it's minimally invasive. It's focused just on the Barrett's lining, which is in the very superficial lining of the esophagus. It doesn't burn deep into the deeper walls of the esophagus to cause damage there or to the muscle in the esophagus, so you don't get complications like ulcerations, bleeding, or stricturing. And it's very effective in eliminating the Barrett's esophagus.
I started here a year and a half ago. This procedure was not available. Iredell Memorial Hospital invests a good amount of resources, to get this equipment. With endobronchial ultrasound, it's a new modality of bronchoscopy. With this ultrasound, you basically can look through the walls of the trachea, the bronchial walls, and you can easily access all kind of mediastinal lymph nodes, masses, or lesions that are in the periphery, but with minimally invasive way. That is a great advantage compared with the traditional ways that were done in the past as mediastinoscopy, was when you have to basically do surgery and they inflate one lung, put a camera through. It's a lengthy procedure and requires at least a length of stay of 2 days. We are the closest place in over 40 miles around that have these available. There's no other hospital close by that has this equipment or people trained to do this procedure available.
The commitment to excellence has been really shown by they're willing to really have the cutting edge technology that we need to take excellent care of patients. Once I came on board here as a part of the Iredell Health System, the hospital committed to getting an O-arm. What an O-arm is, it's literally a thing that looks like an O. And it's an intraoperative CAT scanner. So what that enables us to do is get a CAT scan real time in the operating room when we're doing an operation. Now, it's more than that because it's also what we call computer-assisted navigation. Now what this enables, the computer-assisted navigation, what that does is we can take a CAT scan, we can rotate the image around if need be, see exactly where we're at. So now we can see 3D, so it's safer for the patient. It allows us to do more minimally invasive operations because now we don't have to have as big an exposure to do certain types of operations. And it's faster for the patient. So what that means is they're not spending as much time asleep on the operating table, there's less blood loss, all these things. So it makes a great advantage for taking care of patients.
I think the reinvestment of our monies back into the community and into the hospital shows up with the patients in that they feel an ownership in the hospital. Patients that come here from the county know that we are a not-for-profit hospital and everything that we're doing is to make this hospital better, to make their care better when they need us in that capacity.
In addition to technology, Iredell has worked to expand medical programs to enhance care and improve the health of the community. From specialized geriatrics to occupational medicine, we have responded to community needs.
Iredell Health System is focusing on their geriatric program currently as we are seeing more of the baby boomer population coming to our facility, and as they continue to age and have more comorbidities, we are focusing on providing that specific care for their needs.
A lot of our elderly population, they have dementia and they have other chronic illnesses where it'd be difficult for them to be in the emergency department setting, very stressful environment. Sometimes it confuses them, makes their dementia even worse.
Dementia is probably one of the hardest disease processes for caregivers and their families. So we need to ensure that we're providing the techniques and the skills for our staff to provide the day-to-day care, but also being able to teach their families because not all people live in long-term care facilities.
It's important for me to have Iredell Healthcare as a partner for our facility because it helps, we're both working together in ensuring that we're taking care of our patients as well as the continuity of care between the hospital and the facilities is always the same so that our doctors know what the doctors here are doing as well as they know what we're doing.
What our goal is with the streamlined process with Iredell is to have a seamless transition, and that is really the key to giving the patient peace of mind, which can be part of the healing process as well.
I think the Iredell Health System is setting the ground for what care should look like for the geriatric population. It is not a disease process, it is a stage in life. It should be some of the happiest years of their life. We want to focus on the importance of their lifestyle currently.
Occupational medicine first and foremost is a branch of medicine, of clinical medicine, where you're basically managing the industrial portion of America, the industries, the workers' compensation, workmen's injuries, and that sort of stuff. But it's far more than that. It includes pre-employment physical therapy, pulmonary functions, a whole variety of things. The facility really is a one-stop shopping sort of place in that we are a very broad spectrum. We do have a fully functional physical therapy department with a physical therapist and ancillary staff to assist.
Penske Racing currently employs 423 people. Penske Racing, for the most part, has very few injuries, but the ones we do get are mostly eye debris, strains, lacerations. Having one source when you're hiring individuals and being able to send them to Iredell has been very helpful for me from the HR standpoint, allowing me to take my employees or my new potential employees, send them to one place and get my results immediately, without any lapse in time for a hiring process and getting these people back to work in a timely manner.
So Debbie Staffing is a 30-year strong, full-service staffing solutions company, and we're in multiple states. So we use Iredell Occupational for any of our work-related injuries in the area. We also use them for post-accident drug testing, reasonable suspicion drug testing, and random drug testing. The biggest thing that differentiates Iredell from other health systems is the communication. They make sure that we know what's going on. Iredell does a great job of balancing the needs of the associate versus the needs of the employer. The associate, we want to ensure that whoever we use, we have confidence in that they're going to try to get our associates back to work as quickly as possible and that they understand OSHA recordability. Iredell Occupational, through understanding OSHA recordability, saves Debbie Staffing time, energy, and most importantly, money.
One of the advantages of being an industrial care clinic doing these things is that we tend to do it right. So if you're focused on just the industrial aspects or occupational medicine, then you tend to do these things a little bit better than do, say, competitors or somebody else doing a drug test who may not know the state requirements of drug testing.
Pulmonary rehab is an exercise program that is designed specifically for each individual patient. When I came here to Statesville, I realized that there was a need for the community to have a pulmonary rehabilitation program, since there are so many patients in the area that have underlying lung disease. Patients, if they wanted to take this type of program, they would either have to travel north up to Winston or down to Charlotte. The problem is that these are programs which are twice weekly, for a period as long as 36 weeks. That would really be a burden on these patients that are already chronically ill to have to take that car ride and then exercise and then take the car ride back home. There's a lot of benefit to the program. It improves exercise capacity, reduces the perceived intensity of breathlessness. It improves health-related quality of life. It reduces the number of hospitalizations and days in the hospital. It reduces anxiety and depression associated with COPD. Strength and endurance training of the upper extremities improves arm function. It improves survival.
From its start in 1954 until now, Iredell Health System continues to focus on the health and wellness of the community, partnering with local organizations and offering health education and screenings throughout Iredell and surrounding counties.
Iredell Memorial Hospital, as I say, is owned by the folks who live here, and it's our charge to serve all of the residents of Iredell County and to offer them the best quality health care possible in the world today, and that changes every day. Patients choose Iredell because it provides the best care for the best value of any hospital in the area. I believe we have a fantastic staff, and because it is nonprofit, I think we have a family feel, and the folks know that they're being cared for by people who actually care, because it's someone we may see out in the community.
Our stroke accreditation program and our cardiology accreditation program work very hard in that arena, in having community education events to educate people not only on how to respond when they should have symptoms of a stroke or a heart attack, but what lifestyle changes they can make, hopefully, to never get to that point. We are in that leadership role in the community and community education, and hopefully helping people understand how to maintain more healthy lifestyles, but also know that we're here to take care of them when accident or illness does require medical intervention.
We have people come in that have not only diabetes but pre-diabetes and other medical nutrition issues where we can do counseling and education. Our mission is to be out there helping those people and making them have a better life. That's what it's all about.
We have been manufacturing heavy industrial equipment here in Statesville for 125 years. We started probably in 1980s using Iredell Health Systems to do annual healthy checkups and health assessments, to try to identify triggers. We also now have an on-site nurse who comes twice a week who's from Iredell Health Systems, and she's fantastic. She helps our on-site doctor, so she administers blood tests and can answer questions about drugs and minor injuries, and it's just great having her on site. I really believe that we're investing in the long-term health of our employees, and I think that the best thing you can do is provide wellness services. Really saved us bottom line money on long-term health costs by preventing serious complications. Iredell is the first place we go when we're looking to implement a new program or find a way to get our employees the education and the information they need. They've been a wonderful partner for us, and we know that our employees are getting quality care here in town. That's important.
United Way's job in the community is to mobilize community resources to solve problems. We focus in on 3 areas: the education, income, and health of our community. We've worked with Iredell Health System on our shared mission of improving the health of the people across our community, and they've provided tremendous leadership, guidance, and support as we work together to achieve that goal. In addition to partnering on a number of community programs, Iredell Health System provides the largest United Way employee campaign in this county. Over the last 10 years, they have supported programs across our community in just a little bit more than $1 million. I've been working with communities for a long time through nonprofits. I've rarely found partners who are as engaged, who are as generous, and who are as supportive of their community as the folks at Iredell Health System.
Our Memorial Health System is a beacon in the community, and we've got a role and a responsibility not only to provide the care of critically ill patients, but also in the education and the proactive activities in the community to help people understand lifestyle changes and things that can be undertaken to prevent them from coming here as a patient.
Iredell Health System has a long history of nursing excellence and continues to focus on providing quality nursing care to patients. Part of this is a commitment to empowering nurses and providing continuing nursing education to our entire staff.
Iredell's approach to nursing is really trying to engage them into the care that is provided, to engage them into the decision making so that they do have the autonomy that is needed for patient care. It allows them the opportunity to be on committees so their voice is heard. Shared governance is a way to give the nurses the autonomy or the ability to make decisions for their patients at the bedside. They don't have to ask for permission.
Our leadership is very invested in our nurses and their continued education, as well as the needs within our organization. Who better knows the needs of our floors than the actual floor nurse who does it day in and day out?
I feel like our opinions are constantly being thought of, and our managers and our directors are always coming to us asking us if we have questions or concerns, and they're involving the floor nurses in more of their upper management meetings and their administrative meetings and education.
As a nurse, I can't stop learning, so I think that it's a wonderful opportunity for our nurses, but not only our nurses, all of our staff, that Iredell Health System is taking that proactive approach, which ultimately leads to better patient care, quality of life, quality of care for our patients. Focusing on that front end to make sure our staff is equipped as we have more demands and more needs that are put on our nurses.
Iredell is really about promoting education and patient satisfaction. They provide scholarship programs that help you advance your education, BSN and beyond.
The Institute for Nursing Development and Education is a wonderful resource that our current nurses have, and it gives them the opportunity to look for funds to help with certification for conferences. Research indicates that the higher the education, the greater outcomes patients have and the lower mortality rate that our patients have. So we know that by giving them the education and the training that they need, it in turn gives back to our patients for them to be able to receive the safest and the most quality care that we can provide.
The Golf Classic is a truly unique thing in that it came from nowhere just a few years ago, and now we're raising a pretty good amount of money each year to provide our nursing staff with the opportunity for greater education. I support the Iredell Golf Classic because those funds go to our nursing program to help keep our nurses on the cutting edge of new ideas and continue to develop as nursing professionals.
Nurses really do have that calling to be a nurse, and when we are called to be a nurse, then we have that passion, we have that compassion, and we have the ability to provide care in a way in which is really perceived as being that you are my only patient. You're the only person that I have to take care of, and what your needs are matter to me.
What makes Iredell Health System truly great is our staff. They're the heart of this organization, and we're dedicated to providing them with the resources, tools, and education they need to deliver high-quality health care.
I think the administration has been quite supportive of whatever requests have been made by the physicians, and they have had, so since last couple of years I've been here, I've seen a significant improvement in our endoscopy department, because that's where I work every day, and I've seen new technology, new scopes, I've seen this new equipment since last 2 years. So overall it's quite pleasing to everybody.
As I was finishing graduate school, I was looking for professional growth opportunities and found a position here at Iredell Memorial Hospital. As I was researching the organization and learning more about their mission, vision, and values, they aligned with mine. So as I came on to the interview process and learned more about the organization, I found this is a wonderful place to work.
Iredell Memorial Hospital has been the predominant hospital that I have worked at and that most of my patients have wanted to go to for their care in the 30 years plus that I have been in Statesville.
I chose to practice at Iredell because of the community feel. My father was a physician and had his own practice. He worked for a nonprofit hospital. And when I finished medical school and residency, I wanted to do the same. I never wanted to be a number as a physician. I wanted to be somebody that people knew. And at Iredell, the nice thing is people know each other by first name, and if they don't, they go out of their way to see who you are. And that's hard to find nowadays in healthcare.
The hospital is really a tremendous place to work. I think they work very hard to provide professional advancement for their employees. Even though we've grown to 1,500 to 1,700 employees, we still have a family type atmosphere where everyone works together to try to meet the patient's needs and supply the needs of the physicians in the medical community. So I think it's a great place to work.
We have a lot of things available to us on our wellness program that we go once a year and we're evaluated, and we can get the exercise we need or help with our diet or whatever we need to meet our goals.
The thing that attracted me to Iredell was the fact that when I came to see the hospital, to meet the members of the healthcare system, I sat down with the very people that make the decisions in the hospital. They listen to my concerns, I listen to their ideas.
The nursing staff and the staff is very outstanding. They're very compassionate. I've worked at quite a few different hospitals before, but I've never seen such care and compassion provided to the patients that I see at this hospital.
And I think that that's one thing that Iredell does such a good job of is helping us all focus on the patient and the experience of the patient. They want it to be an excellent experience from the time they walk through the door to the time that they leave.
The addition of new physicians and programs at Iredell Health System has been driven by our mission to improve the health care of the community. With the support of the physicians, nurses, and staff, we have developed award-winning programs to meet the needs of the growing community and will continue to do so for years to come.